All right. Okay. So Daniel, this is, I think you could probably answer this. I've got a lot of experience in the EP sector. So what does an average day look like for you, and what could an average day look like for a potential EP? And like, is it all the same for just for our viewers? Is every EP's day, are they all the same, or is there a lot of variation? Yeah.
Yeah. So again, you'd ask 10 EPs and you'd probably get 10 different responses. So here's my response. For me personally, I have a unique position of being within education. So I mentor clinicians. So today I've had a couple of online Zoom sessions where we go over case reviews, we go over clinical frameworks, and they kind of give have challenges and they need someone to bounce ideas off. So I like act as a supervisor or a mentor to help guide how to apply like a person-centered approach is the buzzword to practice. So that's like my role on, I would see maybe I have group mentoring and I have one-on-one mentoring. So an average like between 4 to 8 clinicians per week, sometimes a bit more. And I also run in services for groups. So that's all online. So I'd be in front of a screen, and I have the luxury of having full autonomy and choice over my schedule and my time because I work for myself. So other EPs would have, say, time blocks, and you would just need to be available for seeing clients. And that's what my experience was like years ago when I was working in a private practice. Then seeing clients, again, home visits. So there's factoring in travel time, there's factoring in what kind of equipment they need. So for a lot of mobile roles, you need to bring in like kettlebells, you need to bring in some weights, and factor in the travel costs as well to your day. Now, if you're in a clinic, you're generally expected to do all your notes, do all your admin, and to see clients within the time allocated. So it varies with appointment schedules from the lowest I've ever heard is 20 minutes. Most, though, are 30 minutes. So from 30 minutes to 60 minutes.
Yeah.
And then you're generally encouraged to fill in the time with as many patients as you can, because that's how the clinic runs. If you don't see anyone, you don't get any funding, you don't get any money. So you have to kind of schedule your time. Most places have note-taking times. Most of the time, you're not back to back all day, every single day. But yeah, so it's a combination of all the notes, all the reports, all the admin. For some places, you also require reaching out to GPs, marketing, blog writing, doing programs, programming for clients, talking to clients, answering emails. So this is all part of our role as a clinician.
Yeah.
Generally, in private practice is where I'm talking here.
Okay, cool. And so, yeah, you mentioned earlier that when you first came out, you lacked that sort of that mentorship from your sort of superiors and that sort of like in terms of like, did you receive in services back then and stuff like that, or was it? Because I noticed you're
Yes.
now doing that, which is great to hear, and that's something
Yes.
I,
Yeah.
yeah,
And a lot of places do offer in-house in services. And I did receive like depending on the place, every fortnight we would get like a topic, and one of us would present for say an hour. So they would block out an hour, and there's a PowerPoint slide, or there's like workshop worksheets, and we'd go through a topic or we'd go through some research. What I found was the topics were, how to say this in a nice way, were more geared towards like a pathoanatomical structural diagnosis. So like a typical treatment styles and philosophy of a physiotherapist. So that didn't really apply to the way that I was practicing. It would apply more so if you were in an acute setting. So kind of had to adjust and adapt the information that I was given to my context. So what helped me was courses. and like going to CPD courses. So you can look up, have you guys seen the ESSA courses that they run, like CPD,
Yeah,
external professional development?
I'm aware of them. Yeah, a few.
So I would highly recommend just looking up what kind of courses are out there. There's a whole like wealth of different topics and different subject areas, and it's just interesting to know what is out there, because that is ongoing learning and education,
Yeah.
and that's where I learned so much more than in-house with
Yeah.
kind of the in-services that we were doing.
And
Okay.
I think just to go back to the question, now even though we're the ones that asked, now that I look back on it, there is a certain flaw. The question is inherently flawed a little bit, because what does an average day look like implies that there is an average day. But then it isn't only EP. This any degree, no degree has an average day. You could have, just like EP has a big range from, I don't know, pediatrics to eating disorders. Maybe an engineer could, I don't know, work from a bridge to, I don't know, making toys, like toy cars, something like that.
Well, that's
Yeah.
what comes with any health sort of degree, doesn't it? Because you're dealing with a large client base, and everyone is different. Everyone has their own unique story, their own problems, and I guess that's what keeps it interesting. If I'm right, Daniel, like you get new people all the time, new challenges, new problems to solve, and that's something that's interests me about any sort of health degree. Is that's what keeps it interesting.
Yeah, absolutely. So I would say, yeah, it's a good question to ask. And to make it even better, what's your average week like? And then everyone's is different. Like I know a few EPs that have a day off, for instance, so they only work 4 days a week. I know other EPs that have 2 or 3 jobs. So they work on a weekend with a sports team, for instance, covering sports coverage. It's helpful to get insights into what kind of roles, what kind of expectations, responsibilities each clinician has in their setting. So yeah, there's many more shitter questions that are possible, but yeah, good point.
And
It's
maybe
assuming that there's an average.
maybe that question comes from a place of wanting certainty. So you want to know what your future could look like, but then you could flip that around and say, because I don't know, because there's so many options, that's what makes it interesting. And maybe 5 years I could be doing this thing, then 10 years later I'll be doing this, and I've always got something new to learn. That if you look at it that way, as opposed to just one way of looking at it, it opens up the entire like all the job opportunities for you.
There's so much opportunity. Yeah.
Cool. I've got one question I'll bounce off
Yes,
for you guys.
sounds good.
There's a lot of information out there. University, personal experiences. I remember the advice that I was given with my knee pain back in the day with soccer days. But there's a ton of information out there, like in person, university, online, Instagram, TikTok. How do you guys like filter the information? How do you make sense of it all? The competing ideas, the marketing, the inflammatory, controversial kind of topics at the moment. How do you filter it?
Henry, do you want to go first?
Start? Yeah, okay. So I think, talking from myself and Victor's perspective as well, coming into this degree, even before it started, I think both of us didn't, we had the understanding that you look something up on Google, someone says, oh, science says that this is true. We sort of had assumptions that that's valid information, things like that, and weren't very analytical in terms of processing information and making judgments ourselves. Coming into this degree now, I think, even though we don't currently take specific research subjects and have subjects which are very honed in and focused on that sort of mindset, even by creating this podcast, I think me and Victor have ourselves, even in the conversations we have on a day-to-day basis, and even through assignments that we did do where we have to do scientific research, we have grown an appreciation for finding it's in the name of our podcast, what's true. And it's definitely something that we've grown to like a lot more, is all this research and how we can analyze a study and say, well, this is, when you look something up online and you say, oh, some guy's making a claim, backs up and, links a study, and then you go to that study and they've got 5 participants, all this sort of stuff. So finding things like that has become very, very interesting and very sort of rewarding in a way, to sort of critically analyze studies. And that's what sort of helped us to now, coming back to the question, filter through a lot of things and become more sort of more equipped when sort of making judgments on things and not being too quick to make judgments. Yeah, that's my answer. Victor, do you want to add?
Victor.
Okay, so I have a few things written down. So one of the points is the hierarchy of evidence, that pyramid that we all know and love. Obviously, we're going to prioritize meta-analysis and systematic reviews, randomized control trials over non-randomized trials and observational studies and stuff like that. That's something we learn at uni. But then also acknowledging that just because it's a meta-analysis, just because it's systematic review, doesn't mean it's correct. If you put in bad review studies, you're going to get out bad studies. And one big thing about how I personally filter information, and it's something I'm still working on, is acknowledging that there is no black and white in almost everything. I feel like a lot of people have that black and white view, either this works or it doesn't. But then exploring the nuances is much more, it takes more brain power, but it is closer to the truth.
Yeah.
And being comfortable in that gray area. Maybe this might work for this specific population in this body part if you do it this certain way, but maybe if you don't do it this way, but at this body part, it might work a little bit. Understanding that it is not just black or white. There is nuance to everything. So
every scenario is different, right?
The more I do research about like how to interpret studies, the more I found out that this is actually the case. And another thing is the evidence-based funnel, which I've recently been aware of, which I'm still learning, by the way. I don't have a complete understanding of it, but from my understanding, it's getting all the best possible evidence and putting it through your personal experiences and then filtering it down to the patient expectations and whatever. That I feel like that's, while I'm still learning it, is a good guideline for me to filter out what may or may not be the best for the client. And then one last thing is learning about all the different biases that can occur during studies. For example, I didn't realize how important randomization is and blinding, and how important these things are for getting an accurate estimate of the effects. So those are all the things I really consider when interpreting a study and filtering all the information that I come across. So yeah.
You both are like 10 years ahead of where I was first year. So I'd say keep it up. Like keep questioning things. Question what I've said in this podcast, question what, all your friends and the people that you admire and look up to. I think that's also important. Because we can make assumptions. If we trust someone, we don't really question it as much. And this goes along with lecturers, with tutors. I remember having a few lecturers who were super smart. Like they never said or ah. They had the best way of explaining everything. They're like the kind of person where every sentence is like gold. Every sentence is like a tweet or like a, you would post one sentence that they say and it would get like 100 likes. That's kind of the value that I see in just their communication was on point. And then I looked up a more zoomed out perspective of their topic area. I'm like, oh, they're actually like quite limited in their knowledge. And I thought that they were like the bee's knees. They knew everything about this topic. So yeah, I think it's important to reflect on the questions that we're asking, like you've already done in this episode, like this, the assumptions within the episode, within the question. And yeah, it takes energy, it takes time to look it up. So keep up the great work. You're definitely on the right track.
It definitely comes down to your own desire and commitment towards it. Like us, everyone in our cohort, it's easy to just sit back and sort of just go with the flow, learn what's coming towards you, and that sort of thing. But realistically, to take the most out of the course, we're working with on a day-to-day basis, and we're being taught by researchers themselves who are basically like you, like me, like have that same drive and hunger to find answers to things. And that's what is so valuable about the university experience, I think, is that making the most out of being able to talk to these tutors, talk to these researchers, and see what they think and what approaches they take, because that's how we like can really grow and learn to become the best version of ourselves and best practitioner of ourselves.
I agree.
Absolutely.
Yeah. I think, the more perspectives that you get, the more of a better understanding you'll have. So if one person says one thing and then another person says another thing, you can then explore that. Why are they saying this? Why are they saying this? How does that fit into the overall picture? Having that understanding, which isn't so far hasn't been taught to us. It's something that we have to go and learn ourselves how to critically think. That I feel like is really important for getting a good understanding of just research in general.
It creates such interesting conversations. Like an example, the other day, me and Victor were outside a classroom, waiting to go in, and all of a sudden we were talking about. We had this really deep. We were like, "Oh, I wish we recorded this," but we had this like sort of really deep conversation about the importance of diagnosis and how important it really is, and sort of touching on both diagnosis in terms of physio and EP, and it was a really good conversation. And that's sort of what starts to happen once you attune into these sort of ideas of research, and it creates a lot better conversation, and it's a lot more engaging experience.
You're right. I agree, because imagine if there was only one true answer, like this is true. That would be a very boring conversation. That's a good way of putting it. It becomes so much more colorful when you start adding all these nuances and specific context in this works or may not work as well, or maybe there's some bias in this study, or there's less bias in this study, or it's clinically meaningful in this case but not in this case. It makes it way more interesting. I like the way that you put that.
Yeah.
I'm just here in admiration. It's awesome. I wish I had these conversations. I get stuck on like shitty conversations generally of like low value, inflammatory, yes or no. Like, is this true or is it not? It's like, well, what are you talking about? But they just people want a quick answer. I guess I'm stuck in the Instagram scrolling.
Yeah.
But yeah, I think these conversations, the actual deep and meaningful conversations, are so much more enjoyable. I think that's important.
And there's room for both, there's room for those quick answers and quick things, but you got to have the best of both worlds, really. Victor, do you want to?
Yeah. Okay.
Question?
So I think we'll skip.
Turn, isn't it? Oh no, he just asked us. Sorry.
Yeah. And maybe what if we had this as the final question and then final thoughts?
That's all right.
And happy to have another.
Yeah, go ahead.
I'm just going to invite myself again to your podcast.
Yeah, you're welcome anytime. So for the last question, Dan, what direction do you see the exercise physiology profession in the next decade and in the next 100 years?
Went straight to the hardest one, didn't you? All right. Hardest question out of all of them. Let's go 100 years. So these are just the first things that come to mind. 100 years, the Earth's going to be different. The entire planet is going to be different. The way that we're heading towards, so like zooming the fuck out into how our environment and our context shapes what we can and can't do. Something's got to give, and our environment is going to affect our health. So we're starting to see, for instance, the pollution, the like plastics in the environment are affecting our diet, are affecting our nutrition, are affecting the air that literally the air that we're breathing right now. And so our healthcare system, all of us, will have to change. We'll have to adapt to what the problems are from the public, from the people. And I don't know what it's going to look like, but I know it's going to be looking so vastly different. If we're still doing the same shit, if we're still talking about the same things that we're talking about in this podcast, we're probably doing the wrong job. We'd probably just be like philosophizing healthcare. So healthcare will change according to what the problems of people are, according to what the health problems are. 10 years from now, so like 10 years ago, we still had EP. So would say it was recognized 20 years ago. So if, based on that framework, in 10 years' time, I would hope that there would be some kind of merging of musculoskeletal pain therapists, but I doubt it because there's, again, too much historical context, too many policies, too many universally curriculums to change for that to occur. And I am doubtful that there will be helpful, productive collaboration between the silos. Because if you go to an EP conference and they talk about pain, and then you go to a medical doctor conference and they talk about pain, it's like you've entered a different dimension because they're talking about pain from a completely different perspective and philosophy, and they're in that world. So the idealist in me is like, we should all merge. MSK professionals. The realist and maybe a bit pessimistic is like, oh, I don't think that's going to happen. But I think EP should and will change and adapt over time. There's this idea that specialization will lead to better results, and I'm in two minds, because when going through the accreditation for, say, titling, so say I'll become a titled pain EP, whatever the fuck that means. So that will give me more quote unquote power, because people will refer to me because I'm the pain specialist, I'm the pain guy. That's
creates confusion.
Yes, and it's also assuming that I'm better than other people just because I have a title. I think there's too many. It's just leading down a path where it's like we're zooming in even more, and then it just becomes like a speck, and we have a microscope that we're zooming into one little bit of pain, and we're not taking into account all the other factors that contribute to pain. So I could send someone to a personal trainer who has pain, and they might get much better results because the personal trainer actually listens to them. The personal trainer like validates their concern, and the personal trainer modifies the training program according to their injury or according to their pain. Then I go to a titled EP in 10 years. That title EP is probably not going to listen to them because they're seeing people back to back and they're making more money, and money's time. I'm just like showing an example here. And they're going to like pain-splain them and tell them what's wrong with their body. And they're going to kind of treat them like as though they're a specialist and they know the answer. So who would you rather kind of refer your best friend to? I personally would refer to someone who is humble and who stays up to date regardless of their title. So back to the question, I think that's where we're heading towards. I think, and you can correct me in 10 years' time, we're heading towards like specialization in different fields. And I think there's going to be pros and cons. Maybe in other sectors that I'm not aware of, like neurological rehab, respiratory rehab, pediatrics, I think that's more valuable. Within my niche of MSK pain, I don't think it's going to be helpful in the long term.
Yeah, well, I think just to add on that, there's, especially for professions like physio, I think definitely it's going to lead to expansion in sort of specialty areas because of the volume of people coming out of physio. Like there's just an insane number of physios coming out every year. So there needs to be space for these sort of physios, which I think will drive what you just said there. And definitely in the longer term, staying with EPs once that picks up. But yeah, be interesting to see what happens.
I like the point of they're having in the short term, next 10 years, you could either merge as one, or we could all go into our separate niches. One of those two things will happen. I don't think there's much other options. So if we know either of those are going to happen, we got to know the pros and cons of that, and I guess be prepared in a way. So what could we do if this happens? How is our way of practice going to change? I guess being aware of that earlier will help you in the long run. And then in terms of the 100 years, that's a really good point, Daniel. I always thought of the healthcare system as just one solid, immovable object. I forgot that it needs to adapt to the needs of the public, which is something I definitely overlooked when asking that question. But maybe it could be that right now chronic disease is at an all-time high, lots of people with chronic disease, but maybe in 100 years we find the cure to many of these chronic diseases, and maybe EPs might not even exist. That is another thought, right? Or it could get worse, and the demand for EP grows. So
it sort of comes back to that. It comes back to that thing we were talking about earlier, just between us, was the course that UNSW has now put forward, which is the integration of the Masters of EP and Physio, with a Bachelor of Exercise Science.
Yes.
So that's leading the charge. That
heading
course hasn't been created before.
Yeah.
So that's them realizing, in my opinion, that look, there's some tension between these two professions, and there are similarities. Can we appeal to students coming up and take that confusion or decision away and be like, here's this degree, and you'll come out of it and you can have both qualifications, and then maybe eventually, if this takes up and it becomes popular, EPs and physio will merge into one. Who knows? But that's probably going to happen in a long time, but you never know.
Yep. I think the one thing to finish off with is we're talking about the healthcare professional layer. I touched on very briefly, just mentioning Earth, the planet. There's politics, there's social theories and sociology and culture, and how culture shapes literally the language that I'm using. Like me saying literally when I'm in the 1980s, if I said literally, people are like, what the fuck, what are you talking about? So history and sociology and culture will shape what we're doing right now. That's the top layer. We're talking middle layer, like healthcare professionals. We forgot the main layer. Patients.
Yeah.
Clients.
Very true.
Fucking pain is increasing. So I think we can get stuck.
Growing
and myself, I'm like,
population.
Yeah, absolutely. I get stuck in the conversations where I'm like, I realize I'm talking to clinicians and I'm forgetting, what do patients need? What's happening with our healthcare?
Exactly.
What are their problems?
The purpose of healthcare.
Exactly. Like we can so easily get caught up in what's best for EP and then forget, who are we here to serve?
Yeah.
That bottom layer.
The best for EP is the best for patients. So
you'd hope so.
Yeah, hopefully.
So hopefully this has sparked some conversation. That fucking great questions.
Great, yeah, really good conversation, I think.
Loved it.
Great.
Yeah. So Dan,
well, thank you very much for coming on. Yeah.
Thank you very much. If people want to find out more about you, where should they look?
Arbilla Exercise Physiology on Instagram was probably the easiest, or on Facebook. And yeah, hopefully this sparks some questions and some curiosity. I think keep up the great work that you're both doing. I'm jealous. I wish I was at your position first year, honestly. You're doing an amazing job. So keep it up. And please feel free to reach out for a part 2 or whatever this is, part 3.
Yeah, awesome.
Definitely. Thank you.
And if anyone has questions at all about anything that Daniel said, definitely shoot him a message.
And follow What's True Health podcast.
Yes.
What's your handle? What's True Health podcast. That's right. I got it right.
Yeah.
On Instagram.
Cool. Well, thank you so much
for joining us.